Hello, this is the Everyman Can podcast based on mental strength, how we can use it in our everyday lives, interviewing local people, using their experience, their wealth of experience through their personal journeys and their own professional journeys, how they use it for themselves, how they use it for other people, and hopefully you can take something from it. We hope you enjoy.
You weren't ready for that, were you?
I wasn't. I thought you were going to do something else. Welcome to another episode of the Everyman Can podcast with me, Matt and Rich. How are we all?
Really good. Quite excited.
Why?
Well, yesterday we had the launch. Well, Everyman Can kick feels very real now because yesterday we had our launch of our Fire and Ice community sauna on Marsk Beach.
Feel refreshed.
Yes. Well, we sent a lot of people home, didn't we? Feeling quite refreshed as well. All red face, big smiley.
It was good.
Kind of warm look to it. It was brilliant, to be honest.
All coming to life.
It was good.
Yeah, it was great. Thank you very much for the help out, Matt Horman. But Matt Stones and I had a good time doing it, I think, and figured out a few things.
It was nice to sit and just listen to people's stories as well.
You learned something about yourself, right?
I did actually.
Go on.
I really did. So for me, I'll say what I commented at the start of that sauna session. I thought, you know what, that probably isn't for me. That because I'm very in my head thinking and talking, whereas Richie he talks for England. Which you've probably gathered on other podcasts.
Dare you?
I'm joking. Well, you do talk a lot. Right. So, but I'm the opposite, and that's why we probably we all have our different skills. But then I sat in the sauna talking to people, and I just talked, and I think it was because of the stories, and people were there for, you say about like-minded people. People were there for the same reason, and it was just good. Like there was trauma stories, there was past stories, there was I was asking people what to do in their jobs, and it was just I loved it, and I think that's how it should be. So going forward, I think that's what we're going to do anyway, aren't we? With the sauna, of just get people down to listen to the stories. And I loved it.
I think some of the skills we've both been trained in the past, like we've both done NLP, haven't we? And I think one of the things we wanted to do is make the sauna space a safe space, and encourage people to have that. And that's what emerged, and I just felt it happened very naturally.
Worked well.
It really did work well.
Exciting.
Some more of that, I know. So we're going to do another one this Sunday, and then fortnightly there. We'll start to develop it on from there as a little income stream, so we can do some good men's health work going forward. Excellent. This is amazing. More on that later, I guess.
Yeah, absolutely. Matt,
so we have got with us today someone I've been trying to get on who's been a colleague and a friend and kind of been worked professionally with some of the work I do in public health as well. So I'm very excited about today. So I want to introduce Dr. Iain Caldwell. Hi, Iain.
Hello.
How are you doing?
I'm doing very well. Very good, thank you.
We had, I'm going to read your bio out now. This is something we do at the start of every podcast. And so Dr. Iain Caldwell is a chartered psychologist with over 22 years experience of working in the mental health sector. And you put mental health sector in inverted commas. That's interesting. Iain is an FIT, feedback informed treatment training and supervisor. He's also a CEO, a director of Making Sense Of, which is focused on bringing clarity to the world of human distress and developing better approaches to helping people. Maybe that explains why mental health sector is in inverted commas. You're also a director of APBA, which is the Association of Practice-Based Approach, an innovative organisation who are focused on delivering practice-based evidence in how to improve effectiveness, gain better results, and transform personally and professionally. That sounds right up our street, to be perfectly honest. That's quite a lot. You're a busy man.
I am. I'm quite impressed by that. When I listen to that, I thought, that sounds really good. Whoever's doing that, I want to meet.
Yeah,
that's amazing.
Whoever wrote it.
I'll have to go meet them.
Yeah. Which of those stands out for you the most right now when you think about that?
It's a bit of a shift. It's always had a conversation earlier today that we live our lives forward, but it definitely makes sense going backwards or looking back. It all seems the perfect jigsaw's pieces are all interconnected. Right. And I think it takes a lot sometimes when you're going forward, is it doesn't really feel like it makes sense and it connects. So I'm interested in helping people in the broadest sense. Yeah. Helping people be the better version of themselves they can, and high performance isn't really the right word, but I think better results. Mm-hmm. And that might mean things are going terrible and things go a little bit better. That's better results to someone else who might excel in something.
So it's one point to another, wherever that is for that person.
And I'm a helper. I'm okay being a helper. I really wanted to be a therapist, and I trained in lots of different therapies. But I really wasn't interested in that. I was interested in helping. And I think you can help people in education, you can help people in management, you can help people in leadership, public health. You can help people in all sorts of ways. And I like... I get something out of helping people. If I can get involved and support and make connections with people, I really enjoy that. So at the moment, it's this enterprise, business development, business coaching type stuff. Okay. Better results in a broader sense. Anything I can get involved in, and still helping people, but trying to help people. The first conversation I had today was, how do we help people who work in the mental health system to collaborate, to build a better system, and how do we actually change that on a national scale? That's the type of things I think about. Not that it's welcomed off anyone, but that's what I'm up to. Eventually I might get somewhere with it. But I'm genuinely helping people make sense of it and try to bring clarity. And the conversation I had today with someone, I've got evidence. I sent them an email saying the same thing 2 years ago, and it's took 2 years of being in meetings and talking to people, and frustrating people, until they were willing or ready or able to listen and said, okay, we'll go with that. Yeah. So I wrote a plan, and that plan's slowly being actioned, even though I've been involved with everyone, community transformation, mental health. 2 years for people to go, oh, so what did you say? What were you trying to get at? And it's like it's 22 years in or 24 years in mental health, plugging away, trying to help people think what this is we're dealing with.
Just a bit of context here, I want to just for those who are listening, because we had an event back in April which was looking at exploring wellbeing alternatives to how we medicalise human distress, mental health. And I know you've been an advocate and of this type of work for quite a long time. And there was a campaign, I think, called Drop the Disorder. Yeah. Is that, and you're still involved within that?
I'm connected to the people involved. So they've wrote books called The Disorder for Everyone, how the DSM become this diagnostic manual, the manual that gives people labels. It's ever expanding. And basically, if you read it, everyone would take one or more labels, and it means then it's meaningless, and I can talk a lot more about, but it's a problem of overly labelling. And I think sometimes the labels give the illusion that you have resolved something and understand. It's a circular thing. So if I say to you, I've got low mood, and you go, oh, that's called clinical depression. Somehow someone thinks there's an answer being given. It's called circular thinking. All you've said back to me is a technical version of what I said to you. We're no further forward. What you could say is, what type of things are making you feel a bit low at the moment or upsetting you? Now that's an open conversation where we keep going, and then it's like, oh, what type of things could we do differently so that happen less? That's a different type of conversation that a label's not necessary, apart from it's part of a description of a process. And that's fine to say, something's making me feel quite not good about myself. And it's this type of thing. Okay. And you've got context then, you've got understanding, and you can ask better questions, and you can expand and expand and expand. So that's the medicalisation, the idea that everyone gets a label, and then we've resolved everything. It's got no explanation of why you had that in the first place. And then people treat the problem, not the context of the person. So the focus moves away from actually into, we had this was part of the conversation that I've had for 24 years, including this morning, to say, professional gaslighting, everything that's ever happened to me might be related to the things I'm experiencing. Well, not really, because you've got depression, or you've got personality disorder, or you've got this OCD, or you've got psych. And it's like, oh, so all of my life and everything happened is not relevant. I thought, what? No, it's this. We're going to give you this label, and this mental health system designed to deal with the label, not you. If you didn't turn up, it would actually be better, because I could get on treating the label. You become a bit of a problem when you start thinking and talking. And I think that's professional gaslight. I think that's saying to someone that what you know and what you think is incorrect because of something. Some DSM categorisation. It's got no evidence whatsoever.
No evidence,
If you said to someone, you go into hospital and said, I think you've got this, I don't need to do any tests, how many people a day would you kill? Seriously, how many people? Tens of thousands of people would be killed every day. You say, I'm not going to do a test. I'm not going to test my ideas out. We're not going to measure. We're not going to test and do other tests and try to investigate. In mental health, that happens every day, every single day. It's like, oh, I know what you've got. This is the label. This is the pathway. This is the treatment you need to go on. This is what you do. And if it doesn't work, then somehow you've failed the treatment. Is treatment resistant, rather than it didn't work, or it's not appropriate, or you got it wrong.
It's interesting.
There's a lot in that, by the way. I'm sorry.
It's huge.
A bit.
No need to apologise at all. It's interesting. I think a lot of people hear it and resonate with that as well. I remember a question being asked, because you talked about the embodiment of the problem. So at that conference, someone asked the question and said, well, I experienced depression. Actually, does that mean that I didn't have depression? Does it mean that kind of all, the things that worked for me, that did work as part of the medical model, and I also went backwards and looked back through my life and started to understand more of a holistic sort of experience of how I got here, whether it was trauma and so on. Does that mean none of that was relevant? And that's when you started talking about the embodiment. Yeah. So can you explain that a little bit more as well?
Yeah, I think people... there's a big conversation around is this a is this an illness and disease? Well, obviously it's not. But everything we do is inside of our body. So if I'm put under a lot of pressure, or I'm doing something I don't enjoy, or people give me a hard time, then I'm going to feel that. There's an embodied element to that. So I'm not denying anything physical's happening. It's like if you use lots of exciting words, you might start to feel really good. That's an embodiment of language. Yes. We're not denying these physicalities of experience. What we are saying, or what I'm saying, other people are saying, is there's no evidence of any disease model. The medical model in that sense is wrong. What's called a medical gaze, which is, I just have to look at you and I observe you, and your past life experience and relationships is irrelevant to what is wrong with you, which is true most of the time in physical illnesses, because you can have a physical illness. You don't need to know everything. They can start to do tests and identify. In mental health, it's the opposite. Everything you know, your relationship experience is really, really important. And all of that is you live in your body and it will act out in your body. But that's different from being an illness disease into being embodied. Right. Does that
make sense to me?
I've said this before, and on my journey, the worst thing I ever did was go to GP. Everyone said, go to GP, that's the first step, they'll get you on this road, and it's a horrendous experience. Just show on a screen, ring mind, if you feel like this. And I was just looking at him, and he basically was saying, when do you want tablets?
Yeah.
And he said, I think you've got depression. And I was like, well, I need help.
Yeah.
So listening to you there about the professional gaslighting really resonated with me, because I've never been back to the GP since. And they put me on medication and it was just like confetti. It was like sweets. Like, well, it's ran out. How long do you want? And sick notes are the same. So I found with the GP, I was on long-term sick. And it was, you'd ring reception, say my sick note runs out next week, I'm getting hounded for another one. Okay, how long do you want? And really looking back, I should have said, well, how long does the doctor think I should be off? And then they'd ring you or email you and say, your sick note ready? Another 3 to 4 months off, without seeing anyone and without any interaction whatsoever.
Yeah, I was involved with a GP charity called Prime for about 8-9 years, and it somehow got involved. And there were good GPs who were trying to get GP mental health education. So it's called primary health education for GPs, and it's closed. But there was lots of good GPs trying to help. So there's 300,000 plus GPs, and a fraction of them had any proper training. And I'm still friends with the people who were involved in that. And I spoke to them this week to do Indigenous American healing as part of GP practice. Teaching this, and there's a person over, and they were doing a friend of mine, Venetia Young's doing breath work commissioned by Surrey NHS to teach people to breathe. So there's little tiny glimmers. But the average person going to the GP, the GPs don't have the training. I think they have to do 1 week in the first 9 years of usually shadowing. That's about it. And they don't know anything. And actually, I think it got worse under IAPT because it was, you just need to understand the pathways better. So when someone comes up and says, I'm having a hard time, I've got this, the GP is just thinking, how can I get you out of the room?
So IAPT is the NHS answer for improving access to psychological therapies, right? So, and there's pathways that can lead on to that, from depression, from anxiety, from even other low-level mental health problems as well, right? So that's just to contextualise.
Yeah, sorry. So they would say it's a referral process.
Right.
I was working with a GP. He came on a workshop I was running, a trauma workshop, and he'd had a bite mark on his hand. He was so frustrated from not being able to give people the right care. He sat in his GP practice and put his teeth through his own hand. And I was shocked by this, but he was just like, if you care too much, it's not good, because you start to listen and you take things on board, and then you're trying to help people go through this system, and you're thinking, the people who care seem to have the worst outcomes in the professional outcomes, and that's really, really bad. So GPs aren't trained to deal with what you present with, which should be, how can I help you today? What can I do? What would make a difference? What do you need today? And some GPs can do that, even in 10 minutes. We were at a conference where there was a big argument started, where the therapist in the room was saying we need at least 1 hour with people, and GPs were saying 8 minutes is fine. If you focus on what you need now, or how can I help you, actually 2 minutes is enough if someone does that, because all of a sudden it's opened up about hope and about being listened to and validated and all these other things. But we're pushing people to say, look, there's a pathway, or do you want a prescription at the same time? The more psychological therapy that's offered in England, the prescribing rate goes up. We're not actually dealing with the problem. It seems to be getting worse. I'm not anti-IAPT or psychological therapies per se.
There's a balance to be had, isn't
challenge.
there? And I know that I've seen the stats anything from between 15 and 30% in terms of effectiveness, in terms of preventing people ending up back on that pathway again, which isn't great when you think about kind of, the number of people that are left behind on that, or maybe even don't even find the way into the pathway in the first place.
I might be miles off here, but I went through the medical retirement route out of the police. No choice, just this is, and looking back, it's what was needed. But in a 10 to 11 month process of being sat at home waiting for appointments, repeating my story 9 times, I think, the same story. The process doesn't allow you to become better.
Yeah.
So, and I'm a true believer that I had to remain ill, and the process, I couldn't heal, and I'm now going through the process of trying that, but because of the repeating of the stories, unprofessional appointments. I had one appointment on Zoom, completely impartial, and the doctor came on, and it was up to him whether I was to be medically retired. He went, look, I haven't read your notes, I haven't read anything about it, I haven't had time, tell me your story. First words out of my mouth were, are you taking a piss? And I just sat and cried, and it was really difficult. Did not get it at all. You haven't got PTSD, you've got a depressive disorder. Challenged it, had another appointment. Doctor says, don't need to go for everything again. I've read everything. Where are you at now? How are you now? I was like, so really interesting listening to you about the professional gaslighting. That is really, I've never ever thought of that.
You had to have, one of the things we talked about quite a lot was the necessity for you to have a label to be able to get through that process. It's like he couldn't survive. It was like a passport to get him through to his destination.
But I'm not blaming individuals for this.
Yeah.
The system.
Yeah. Yes, that's it.
And one of my really good friends has just gone through the same process out of the police, and I kept saying to him, you can't, it's awful, but the process doesn't allow you to be well because it takes that long. As you are starting to feel better, you've got another appointment coming and the anxiety kicks back in, and what happens if they don't get it, they don't know me, they don't see me day to day, and it's again, not a dig at individuals, but the process around that made me worse.
Yeah. I think we're in the infancy of dealing with any of this really well. So I think from the start, I have wrote a policy. The policy would remove the ability for a GP to be involved in mental health. I've wrote that policy. I've tested it out, and I'm ready to go on nationwide with it. I talked about this on a wellbeing responder course that I ran. I didn't know someone was on the course who just tried to end their lives. And what I said in the session, I said, you should not have to remove yourself from work, but you should be able to talk to someone in work, and work should respond to say, there's lots of meaningful relationships at work, there's good people in work, there's obviously bad people and toxic places. I talked about this, and this person came up and said, I'm going back to work because I've been given a sick note, and now I've spent 2 weeks alone. It's worse than before. I need to be at work, but I'm going to go back after listening to you and say, I can't do the job I did, but I need to be around. We grow. How do you grow mental wealth? Through relationships, meaningfuls, care, being useful. That person was like, I'll do anything. I'll clean the bins, but I won't sit in the house all day and night. I feel worse. Yeah, exactly. Yeah. So remove it. I think we should remove it, and then we have systems that maybe should just have the default of assuming that I believe you. And if you didn't need a diagnostic, a DSM label, there's another alternative called the ICD, which is the International Classification of Disorders. And in there's really interesting. So say you were homeless, you would get A127 or something like that. If you experience domestic violence, would be another one. You can just put codes, and then at the end of it, you don't need anything else, because people say the description of all of your challenges we're going to list, and that is sufficient to get benefits, to use it around the whole of Europe. There is an alternative where you can, and even that's not brilliant, but at least you can put in difficulties. You can have childhood difficulties, and they just give you a code for everything, and all of a sudden it wouldn't matter if you've got depression, if you've got PTSD. You would say, you've got another 15 codes here, so once you pass 3, you're in a bad way. That would transform. You would just assume you're in. So how do we help you?
So that is really interesting. And again, I'll fall back on my experience because it's all I know. So I had GP to forced medical advisor, psychologist, PTSD, psychiatrist, 2 FMA appointments, which were GPs on the other end of the phone working for a company. Then at the end of it, I've had to have another one around an injury on duty sort of thing where they assess you again. So at the beginning of the process, you've got psychologists going, yeah, you're not well. 9 months on, not any better, in fact worse. Appointment, emails, waiting. It's an horrendous process for anyone to go through. And I think, yeah, the coding, it should be, yeah, you've hit 3,
Yeah, just accept it. And it's really bad.
But they don't want you to be well. They don't want you. In my experience, I get the impression they were desperate for someone to say, he hasn't got PTSD, he can come back to work. And I think that's why they prolong the process, is to almost try to push you to go back to work. Do you understand what I'm...
Yeah.
It's not a conspiracy theory. I think the whole process is designed that this might cost us. So I think it is.
I think it is a cost thing. I think they're trying to test, they're trying to work out. It's bureaucracy. It involves so many different people, but it's not helpful. And wouldn't it be good if they started to help and deal with the issues and just accept that there was a problem, and then what's the consequence of this? So the other thing is what happens with the labelling is it gets rid of your story and context. Which means, I know we've talked about mental health first aid, there's lots of people who do it very well, and it's got a good agenda behind it, but it doesn't say, is your boss or the workplace the problem?
Yeah.
It says that it's probably inside you somewhere. I'll put my arm around you, I'm going to take you somewhere, rather than actually it might be the KPIs, it might be the work environment, it might be, whatever pressures are going on. And I think we have to acknowledge that actually there's only 3 things that causes problems. Trauma, toxic environment, and thought, but thought could be meta skills or mindsets and things. So basically the 3 T's, that's all it is: trauma, toxins and thought. That's it. If something falls under that. So with them combinations, you can explain every single thing that everyone's ever had. And that involves the context we're in, the world we're in, our story, our relationships, our community and everything that's ever happened. And if we got rid of the medical model, we would transform and deal with this instantly, because you would be confronted, and through the HSE, the health what's it called, the health and safety executive. You can be sued for corporate manslaughter now. You can be sued for causing distress. And I think we should do more of that type of thing. And if we had a different model, you can see why people invested to keep it as it is. Yep. We would have to change working practices. We would have to treat people differently. We'd have to have different relationships. Unnecessary pressure put on people constantly to keep up. It would dissolve. And it would become an open national conversation, and it would transform everything.
We're going to, just before we go to a quick break, there's the first question. I mean, it seems like a very good time to ask it as well, is, given that definition there, what is mental strength to you?
So I think it's, because I've done my research, I've listened to it. I think what you're getting to is the thing that this is my problem. Lots of other people growing up is there's not a user's guide for life. You're born, and if things are not perfect and everyone's not perfect, it's a bit difficult. And that's what we're really trying to get, is what's them life lessons, what's the mental toughness. And I think it comes down to, as a quick summary, is the ABC. I think it's to do with attitude. I think it's to do with set of behaviours, and I think it's to do with connections. And I think if you learn and develop a particular attitude, which can be flexible, being adaptive, seeing the world, realising that you can pick up skills and be better at doing things, then it's what behaviours do you need to do. And I've just been collecting them all my life, because the first, 15, 16, 17, 18, 20 years were really tough going, and I wasn't prepared for life, and I was like, where's the manual? I need help here. I'm really struggling. I know I'm mad, and I'm finding it really difficult. And connection, I think it's with people and relationships. There's a phrase which was me/we, called MWE, and it's developed by Daniel Siegel in America, that you can only really understand mental health and well-being from we and me. And I am a little bit annoyed, because in 2006 I wrote we and with instead of us and them. But I never wrote the book, so I can't really be too grumbling about that. But I knew then it was all about relationships, we and with. Mm-hmm. And I think that's what so I think it's about your attitude, which you need to be able to think, I'm going to take this on. I'm going to take this on, but then your connections, who's going to help you take it on? And then what behaviours, what goes in your toolkit, what skills and insights do you need? And that's endless. I'm collecting them, finding them, discovering them, and sharing them with anyone who's absolutely interested. I don't think I've said no to anyone in my whole career or life. And if someone says, can I have some time? It's a yes. And I've never walked away from anyone. Unfortunately, if people listen to this and then contact me, I will get back in touch and I will try and help everyone. And I genuinely will for the rest of my life, because this is what I think it's about.
Thank you so much. What a fantastic definition. Let's go for a quick break.
Just a quick break from the pod, and an opportunity for us to thank our partners, Everyone Active. Everyone Active have numerous gyms and facilities across the Tees Valley area. Sign up with them today. Get your memberships. Physical exercise, as we all know, has a massive positive impact on our mental health also. Back to the pod.
Thanks for that. We're actually at Everyone Active in Middlesbrough Sports Village today as well. Nice. So just sat in the cafe here. A little bit
Cafe Cuba.
What's it called? Cafe Cuba. There's a massive picture of the road, one of the roads in Cuba, isn't there? Pretty obvious as well. We were guessing for a while, and then you pointed out the...
Should be a detective.
I know.
Look at the number plate. Cuba.
Pick that one up on the AMPR.
No, but thank you, Everyone Active. It's, we've just built in and they're letting us use their facilities, and
to record
massive
it.
supporters of us as well, which is really good.
Yeah, it's fantastic. Mental strength then. So you gave the ABC model: attitude, behaviour, and
connectiveness,
and as well. And there's all these there's a few of these models now. When I first joined the NHS 2004, it was not long after that they released the 5 Ways to Wellbeing to match up with the sort of like a nice, palatable public health message for mental health and mental wellbeing. And then they did a whole load more research, and then internationally there's obviously some key leads for positive psychology. They developed the Action for Happiness, and then something called the Great Dream, which is like, the 10 keys to happiness as well. And some of those, it feels like those are like an expansion of what you've said there about attitude. And I feel like behaviours is part of sort of like keep learning, and it's all about yourself and what works for you. And that's something I always say is kind of like, you've got to find what works for you, haven't you, basically? And that even in itself is an embodiment of kind of the idea of having a one-size-fits-all isn't the right way by any means.
Sorry, just on that, when I go back to the GP.
Yeah, all right.
I think you go back to the GP, you go to the GP just to get a sick note. And when you're saying there, like, what works for you?
Yeah.
I knew when I went in there what my purpose of going in there for was, but I genuinely thought they were going to help. And I think it's self-awareness as well, mental strength. And I think it's knowing when you're struggling, knowing your triggers, knowing what your coping mechanisms are. Once you get to grips with that, and I think it's like everything I always say at work, like reflect, self-reflection, reflect after everything that we do to get better, admit when you're wrong, make up. And I think you have to do that yourself as well. So mental strength for me now comes down to self-reflection, knowing when you're struggling, knowing when to be a bit selfish and say, get my boundaries. Yeah. And I think a lot of people who struggle don't have the reflection and the boundaries in place.
And everything you said there, you could embody within that ABC. So behaviours you're talking about there.
But it's the connectivity. So like if you're connecting with your partner and you've got that real connection with them,
communicating well and so on.
Communicating well around your boundaries. Look, I'm struggling. It's not you, it's me. And they'll understand better. Yeah. But what we do especially as men, is we kick back at that. And we become arsey, bit of a dickhead, let's go to the pub, go and do drugs, go and do gambling. And as men, we need to get better at that.
Yeah. There's so much to say. I know that I want to flip it as well a little bit, because I think when we talk about the medical model, it works for some people. And obviously when it says find what works for you, and I could say, well, what do we mean by what works? And I think part of it is some of these pathways in the NHS have broadened their offer quite a lot to take in a lot more well-being approaches that do ask the right questions, right?
It's just about it's being clear. So a clinic being clinical, the medical gaze. It's called a medical gaze. Michael Foucault, who was a French philosopher, wrote a book about the invention of the clinic. It's very clear that there was the beginnings of medicine, which was quackery really in the beginning, but there was an idea that you went off somewhere, and the idea was that you did what they call the gaze. You would look at someone and you would observe and look at the symptoms, and you were able to find out what the illness is, and you didn't really need to do the story. Now that medical model is sort of appropriate for lots of physical illnesses, and not 100%, but it's sort of appropriate. You just don't need it for mental health. So when people say medical, they mean clinics, they mean trying to emulate a doctor, and that's fine if you're dealing with physical illness. So it doesn't mean that we're dismissing things. I think if you just went, I need to know you, your story, you need to know you,
you need to know you,
you need to
crucial,
know you, and we can work on that. There's narrative-based medicine as well, but we'll go off track on this. So it's not necessary, but that doesn't mean you get rid of anything. I think a pharmacist or a GP should be one of the spokes, not the hub. The hub should be something where it connects and has a human conversation, human understanding. But I wouldn't ban anything. It would be whatever works. But I wouldn't put them in charge. I wouldn't be the first point of contact. I wouldn't let them frame, understand, and own the language. Yeah. I think it's like, we'll come to you later on if we need you. So, so it would, antidepressants help some people some of the time? Well, probably, but you won't start off with them. If not, everyone will get a prescription. I think it's 98 million prescriptions in the UK per year. 98 million, more than people are getting them. And sometimes it's forever. There's an idea that you must have them for your rest of life. It's like, well, what about just having them when I need them, if I need them, and how do you come off?
What are your thoughts on self-responsibility then? Around, I'll expand on it a little bit. The more I've gone on my journey and the more we do this and the more people and men who I speak to, you've got to own it sometimes and you've got to take responsibility, and it's not always on other people to fix you.
Yeah, I think you're right. I think it's a bit of a... So, are you responsible for what happened to you? Most of the time, no. Things are out of our control and situation. But at that point, maybe we use a better word, agency. So agency might be the ability to take charge of your life and to influence decisions. Now, there'll be certain times where you haven't got that agency forever, but other people can come around, they can hug you, they can be with you, they can listen with you. You start to build a bit more confidence, a bit more strength, and then the agency switches back in. So, and encouraging people to take agencies and that sort of intrinsic motivation to make a direction. So it's like, yes, you do need accountability, but it's when... If you put into a situation and you're overwhelmed or things are out of your control, there might be times where you haven't got it. And that's okay. There might be times where you need to go, maybe to a crisis house for 3 or 4 days and people look after you. And then once you start to feel better and feel able to make decisions and you feel that strength coming back, then the responsibility comes back. So it is in there, but I think it's understanding when it's switched on or measurable and when it's not, if that makes sense.
No, I get it.
It does. I mean, even the decision to allow yourself to submit to whatever support you're going to get is in itself agency, isn't it? And actually, that's a big. It's quite a stretch for some people to get to, because in some sense they're sort of they're not seeing their own role within their own experience, whether if it's a negative experience, and actually it's quite a leap for people to get to that point in the first place, isn't it?
Yeah, there's the people talk about recovery. Sometimes I think there's a better word, which is to reclaim. And I think it is about reclaim. It's about taking back everything. I'm going to be in charge of my mental health. I will accept support, and I need help, and I'll have peers and everything else. But it's about reclaiming your story, reclaiming your identity, and reclaiming your understanding through self-awareness and reflection of where you are. So sometimes recovery, sometimes I think it's like, I was doing really well, I went back and I need to recover where I was. Yeah. Some people have never been at a good start, they've never actually had that, so I think it's slightly unfair. But what you can do is reclaim your life, starting to take responsibility, starting to grow agency, and help people show what good agency looks like. I have mentors, some people think I am their mentor, and that's quite, unbelievable that someone would have me as a mentor. But it's like, I think if I didn't have coaches and mentors in my life, I'd have found it really difficult. And I've spent 7-8 years with people who have very severe experiences, who were my mentor, and they've mentored thousands of people in this country to still have them experiences and still get on with their life. Yeah. And that's extraordinary for someone to see. If I have these strange experiences, I can't live a normal life. And then you see someone with the same experiences living life, but every now and again they will need a break and need support like everyone else. And I think that's like an amazing lived experience forums and hearing voice and that. But there's a whole host of things out there. You think, that's unbelievable, that person's been through that and look at where they are today. So that's really inspiring. But it doesn't mean that you're always feeling that good. Sometimes all of us can have blips and do things we're not proud of and struggle. But it's feeling comfortable enough to talk about that without people labeling, jumping on, and this is what you've got. It's just like that human condition is a bit of a mystery. I think we should tolerate ambiguity and not knowing, and should be more curious to think, well, we haven't got all the answers. I think one of the things, not you're asking about social media, the people will come on there now and say, we've worked it all out, we've got the answers. This neurochemical is in you, and that's what's going on. And it's always more complex. And I think we just stop being we've answered it. We've got the breakthroughs. Because we haven't. We're probably another 5,000 or 10,000 years away from ever getting anywhere close. And there'll be lots of mysteries, and consciousness might be one we never ever get to the bottom of. Yeah. So let's just everyone just calm down. You know what I mean? Stop taking yourself so seriously. Have a bit. Joe Hilton today, who I was with, was like, can you have more fun? Can you just mess about and go mooching on your bike, as he said on your podcast? And I think you should go around mooching a bit more and just take your time, have fun, carry on. Give everyone a break. You know what I mean? If you make mistakes, give them a break. I'm going to make a mistake. You're going to make a mistake. Just take it easy. Stop pushing yourself. Stop taking yourself so seriously all the time. And I think the world will be a better place. And so, have we got all the answers? No, probably not going to. I've got the answers to lots of things. No one's interested. So, I wanted this podcast to be 17 hours long. It's never, ever going to happen.
And it's door banging in the background at one.
No, but why should they? People aren't interested in lots of things, I have to say, but they can enjoy and have a banter, conversation, have fun. I think we just need to be a bit more, a bit humility and a bit more calm and a bit easier go and just take it easy, chill a bit more.
What do you do? Having said all of that, what do you do yourself? If you had a sort of your own toolbox of, to maintain good, let's say, mental strength yourself, what do you do in your own life, Iain?
One of the biggest changes is I run. I run 250 times a year or thereabout. So I never did any sports, athletics, anything in my life till about 47. I did couch to 5K, transformed my life. I lost 7.5 stone. And I become a runner. I run today, even though I've got I won't go on about, I've got a really bad toe and it's got really bad blister and it's infected. I still ran 6K this morning.
We'll put a picture up on the website.
Frobbered toe.
Yeah.
So I think that's about attitude or discipline. I think discipline's really important because it can get you through everything. No matter if it's people go, oh, you went out and it was 7-, or it was black ice, or if I ran through a sandstorm and it whipped me face. Yeah. Or Mexico I ran and it was 38 Celsius. Yeah. It was like running in a sauna. It's like, yeah, I'm doing it. Of course I'm doing it. I'm doing it regardless. I've got different clothes I can put on. That's discipline. I'm going to keep doing that regardless. And I think that's really helped me get through everything. So I think that's a big thing. I think sharing, disclosing more. Don't disclose too much, but disclose more. Feeling comfortable with that and telling people that I'm a bit mad. Been very, very mad in the past, bit mad, and I do make mistakes. I made a mistake in the last week, so it's still not over. I'm still trying to make sense of it. It's been okay, reflections and that type of thing, and I think connections, going to meet people. Like I said to Joe today, I said, when I'm with you, I'm the same age as you. I know I'm the same age as Joe Hilton. Actually, I'm about 20 years old. But when I'm with him, I feel like that. I connect to him like a friend, and I just feel like an equal to him. And I passed him on a stair. Well, that's as much as I knew about him. And I want to go and reach out on LinkedIn and say, would you like a cup of coffee and get together? And he's like, yeah, I'd love that. And it's just like, taking chances, I suppose. It's
incredible.
Reaching out, connecting yourself.
You've got to be a bit exactly. You've got to be a bit adventurous, basically. Yeah. You got that adventurous spirit where it's like, I like that one where it's like you never know what you're going to get from any conversation when you meet someone, basically. And I think like as long as you're open and you approach that with it from a point of view of like, look, I have no idea like what we're going to get out of this. Let's just see where it goes. Do you know what I mean? Like enjoy the ride.
And another thing is like make friends. I've made new friends. I've made more new friends in the last couple of years than I have done for the 20 years previous to that, I think. And it's like, I've gone out with and sort of people like, would you like a cup of coffee? Would you like this? We don't go to the pub as much. And it's like, and I tell people how much I like them. I've been trying to hang about with you for ages. I think he's very, very sort of selective. But there's something in it. Do you know what I mean? It's like wanting to be like. It's like, is it hard to make new friends as a man who's a certain age? It's like, we need to get comfortable doing that. Going and talking to people, connecting people, taking a chance and meeting people and. I think that's like a length of like connectedness, but being open to them new experiences and
100%.
what will happen. As you said here, let's just switch record and
Yeah.
I was worried about letting you down. I thought, oh God, I've got to be really good. Come on,
Get away. I think, and this is part of it, isn't it? It's about being yourself and just trusting the process.
yeah,
Like, this is a conversation, and I think, but incredibly, we're nearly at the end of it as well, time-wise. We've explored so much, and I feel like one of the things we need to talk about and get really right is about what the future needs to look like to do this work, to serve people better. But equally, the system to serve people better, people's expectations of what the system should do needs to change. So I think there's a whole piece of work to do around that. I think there's a whole culture shift that needs to happen in terms of not just being good pill takers I have mental health problems, I have this label, therefore I am this for life, and actually the embodiment of it as well. But then what people can do for themselves and getting it, and we've talked about some of this stuff ourselves, haven't we, before, about the egos and getting out your own way and all this kind of stuff. And even finding the right words. One of the things I discovered this week, I can't even remember the term, in fact it's gone, but it's something which is highlighted where some people just don't have the ability to really find the words to describe their own emotions. And it's like, wow, and apparently it's more common with men. And if that's more common with men, that inferred that might actually be one of the reasons why men don't seek support and talk about things. So that high suicide rate might well be affected by the simple fact that we ain't teaching people or showing them how to, even men particularly, how to have those conversations.
And I think this podcast helped him. So one with Joe, I'll talk about Joe Hilton again. On the podcast, he said he was inside his own head, arguing and fighting with himself. I sent someone on the podcast and went, that's me. So sometimes we need to give little examples and go, oh, that's mental distress. That's what it feels. I'm sat in my own head, arguing with myself all the time, doing my own head in. And it's like, wow, they're just like become aware of it and thought, that's it. Yeah. That's it. So we need to be able to demonstrate and then put these words in everyday language that's accessible and understandable. Fantastic.
And I will be getting in touch with you again now as well. The only problem is we'll probably chat for 12 hours straight.
Brilliant.
And have about 8 or 9 pints, and that'll be it.
I'm in.
Yeah.
No, sounds good.
Christmas pie it is, mate. Iain, I'm sure we're going to have to get you on and talk about some other issues in the future as well. It's been absolutely fantastic.
Thank you, Iain. Honestly, amazing stuff.
Fantastic.
Really good.
Thanks for inviting me on.
Thank you. Hope to see you again very soon.
Yeah.
Thanks, Iain.
Thank you.
Have a good one. See you soon.